people are diagnosed with anxiety and take medication for years. But what if the anxiety is not the real problem? What if the real issue is actually ADHD and no one recognized it? There's one surprising situation where anxiety can actually hide ADHD symptoms that even clinicians may miss it. I'll explain that later in this video. Today I want to talk about one of the most common misunderstandings I see in my practice, the relationship between ADHD and anxiety. If you have been following my videos, you know I often talk about ADHD. In this video, we are going to explore how anxiety works in the brain, why ADHD can sometimes look like anxiety, and why getting the diagnosis right is so important, because treatment can be completely different. There are several types of anxiety disorders, including panic disorder, social anxiety disorder, separation anxiety, phobias, obsessive-compulsive disorder, OCD, and generalized anxiety disorder. In this video, I will mainly focus on generalized anxiety disorder, because many patients referred to my practice have been diagnosed with this at some point in their lives and have often been prescribed anti-anxiety medications. Anxiety is a very uncomfortable experience. It usually means worrying excessively about everyday things such as health, work, finances, relationships. People often feel that something terrible might happen. They may feel out of control, and their mind keeps repeating negative thoughts over and over again. Anxiety can also have physical symptoms such as muscle tension, fatigue, poor sleep, stomach discomfort, headaches, and difficulty concentrating. Because this feeling is so distressing, anxiety is also one of the most common reasons people try to self-medicate with alcohol or other substances. To understand anxiety better, it helps to look at how the brain processes threat. To make it easy to understand, I focus on 3 important brain regions involved in anxiety reactions. The first is the amygdala, which acts like the brain's alarm system, almost like a smoke detector. When it detects something that might be dangerous, it quickly activates the fight or flight response and signals the body to release stress hormones. In anxiety disorders, this alarm system can become overactive. Early life stress or trauma can make this alarm system more sensitive. In some people, this leads to anxiety disorders, and in others, it can worsen their ADHD symptoms. The second structure is the hippocampus, which provides context. It compares the current situation with past memories and helps determine whether the threat is real or similar to something experienced before. For example, if someone has had frightening experience in the past, the hippocampus may link similar situations now to those memories and reinforce fearful responses. The third important area is the prefrontal cortex, the thinking and decision-making part of the brain. Normally, it helps calm the amygdala and assess situations logically. But in anxiety disorders, the prefrontal cortex may have less ability to regulate the amygdala, our alarm system. As a result, the brain reacts strongly even when the situation is not truly dangerous. The body's stress system also becomes overactive, releasing hormones such as cortisol and adrenaline. That's why anxiety can affect the entire body. That's how anxiety works in the brain. So how do clinicians diagnose anxiety disorders? Most clinicians use what is referred to as the DSM-5 criteria, which is the main reference used when diagnosing psychiatric conditions. However, in clinical practice, these criteria can sometimes overlap with other conditions, such as ADHD or autism, which can make diagnosis more complicated. Let's briefly look at the DSM-5 criteria for generalized anxiety disorder. The first criterion for diagnosing generalized anxiety disorder is excessive anxiety and worry occurring more days than not for at least 6 months about a number of activities such as work or school performance. If you think about it, many adults with ADHD may worry constantly about school, work, deadlines, forgetting things, making mistakes, because these are real challenges they face every day. The second criterion is difficulty controlling the worries. Again, if the worries are about real problems, such as missing deadlines, forgetting tasks, being late, then it's naturally difficult to control that worry. The third criterion requires at least 3 of the following symptoms: restlessness or feeling on edge, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Many people with ADHD may also meet several of these criteria. Criterion number 4 states that the anxiety must cause significant distress or impairment in social or occupational functioning. Many adults with moderate to severe ADHD may also experience significant impairment because of ADHD itself. Finally, the DSM-5 criteria state that symptoms should not be better explained by another disorder. ADHD can explain many of these symptoms, but it's not mentioned among these other disorders. So my question here is, how reliable is this criteria for diagnosis of generalized anxiety disorder when we don't consider ADHD? Most clinicians are trained using the DSM-5 criteria. Diagnosis often relies heavily on one questionnaire and a brief assessment. At the same time, adult ADHD has historically received much less attention in medical training, so we may sometimes miss the broader clinical picture. This raises an important question. Could this be a reason why ADHD may be misdiagnosed as anxiety? Let me give you a simple example out of many from my experience. A patient once came to me with severe anxiety. They had been treated for anxiety for years. But when we looked deeper, most of their worries were about missing deadlines for getting tasks, losing things, being late. When their ADHD was treated, most of their anxiety symptoms diminished. Now, can the opposite happen? Can anxiety be misdiagnosed as ADHD? Of course, the opposite can also happen, but it probably happens less often. Anxiety may affect concentration, but it usually doesn't produce the full, lifelong, constant pattern of disorganization, impulsivity, or attention difficulties even when they are not anxious. Distinguishing the two may not be as easy, and that's why a careful clinical evaluation and a detailed history are so important. People who come to clinicians are usually not aware of diagnostic criteria. So when someone says, "I have anxiety," what do they actually mean? In my practice, I often see 3 different patterns of anxiety symptoms. Type 1, I would call primary anxiety disorder symptoms. This is when people experience chronic, excessive worry about many aspects of their life, even when there is no clear immediate threat. These worries tend to shift from one topic to another and may persist even when things are going well. For example, your partner is 10 minutes late and you automatically worry about accidents, or you are excessively worried about your health even when there are no symptoms. This form of anxiety often begins in childhood as separation anxiety and may require targeted treatment such as psychotherapy and sometimes medication. Type 2 is anxiety symptoms secondary to ADHD. This occurs in people with ADHD who develop anxiety after years of struggling. Over time, they begin worrying about missing things, being late, forgetting tasks, making mistakes. Depending on the severity of the condition and life situation, the worries may last for months and be almost constant. Example is a student who started living independently and can't catch up with school assignments and is under pressure to do great. Or an individual who is now promoted in their job or has changed their job that needs constant attention, plus family conflicts and handling children who may also have ADHD. By the way, these are very common scenarios. People with moderate to severe combined type ADHD can always feel an inner restlessness. I call it inner restlessness, that they may interpret it as anxiety. Interestingly, my recent finding relates to the third type of anxiety symptoms, which is about sensory overstimulation, particularly in autistic individuals. I see many adults with ADHD who also meet criteria for autism spectrum and have never been diagnosed. Imagine an individual who is very sensitive to excessive noise, crowds, bright lights, who feels trapped and can't escape. They can feel a very overwhelming distress. If they are a child, can outburst and throw a tantrum. If that's an adult, may react so unpredictable, and others often don't even understand what is happening. Over time, the more sensitive ones may not be comfortable even going out because of their fear of large crowds or loud sounds. Some people have only one type of anxiety symptoms, while others may have a combination of two or even all three. So, how do we differentiate ADHD anxiety from generalized anxiety disorder? Many adults with ADHD also have an anxiety disorder, which makes diagnosis more complicated. One question I often ask adult patients is this. Imagine you are on a vacation for a few weeks. Everything is well organized, nothing is pending, and you can just relax. Can you actually relax? Or would your mind still look for something to worry about? For people with anxiety disorder, even in that situation, the mind may quickly find something new to worry about. For people with ADHD-related anxiety, worries are often task-based, like losing their luggage, forgetting hotel keys, or missing a flight. It's not that easy, though. It's often difficult to differentiate these conditions. I find it even more difficult in younger adults and teenagers when they are not yet aware of the patterns themselves. Sometimes we only understand the difference over time during the course of management in multiple visits. Remember earlier I mentioned that anxiety can sometimes hide ADHD symptoms? This is where that happens. Diagnosis can become even more complicated when someone has both ADHD and anxiety disorder plus perfectionism, very common. In some individuals, anxiety actually masks ADHD symptoms. For example, a person with ADHD might typically make careless mistakes more than everybody else. But if they also have anxiety disorder, they check their work repeatedly out of fear of making mistakes. They may rarely lose things because they constantly triple check everything. They may never be late because being late causes severe anxiety. If they have concurrent OCD, obsessive compulsive disorder, unlike most adults with ADHD, they can be extremely organized. But it doesn't mean they don't have concurrent ADHD. So if we rely on just one questionnaire for an ADHD diagnosis, chances are high that we miss this diagnosis. We need to ask, well, you don't make careless mistakes, but how many times you check your work? You never forget any appointments, but how many reminders do you set up? Many of these individuals spend their entire lives under constant pressure and exhaustion, trying much harder than everyone else just to function normally. That constant effort often leads to fatigue, irritability, burnout, and sleep problems. Now, speaking of sleep, have you ever had nights where your brain simply refuses to stop thinking? To differentiate ADHD from anxiety disorder, I often ask about the nature of the thoughts preventing sleep. In anxiety disorders, the sleep problems usually come from worry-based thoughts. In ADHD, sleep difficulty often comes from random racing thoughts. Although there is no cure for ADHD, treatment can be very effective when the correct diagnosis is made. Most people with ADHD experience some degree of anxiety symptoms. When ADHD is treated properly, combined with CBT, cognitive behavioral therapy, and mindfulness, many of their anxiety symptoms improve significantly. In these situations, people may not necessarily need a separate anti-anxiety medication. In fact, medications commonly prescribed for anxiety, such as SSRIs, may not help them, and chances of side effects are higher. So, if someone doesn't respond well to our treatment for anxiety, before adding or changing to another medication, anti-anxiety medication, think about the possibility of some underlying condition. Now, let's talk about treatment for true anxiety disorders. Imagine a child growing up with constant anxiety without even recognizing it and without learning coping skills. Over time, with chronic stress and elevated cortisol levels, two things may happen. The brain chemistry changes, and the brain gradually develops habitual thinking patterns. These patterns lead the person to interpret many life situations as threats. So, what do we do about it? Anxiety disorder treatment depends on several important factors: severity of symptoms, duration of the condition, whether symptoms have been lifelong or more recent, and the number of relapses over time. These factors help determine whether someone may benefit mainly from psychological interventions, medications, or a combination of both. Cognitive behavioral therapy, or CBT, together with mindfulness, are two of the most important treatments for anxiety disorder, also for ADHD anxiety. Practicing these techniques help retrain the brain. The goal is to gradually shift the brain from automatically reacting to life situations as threats to interpreting them more accurately and responding in a healthier way. However, this change requires consistent practice over time. It's not something that happens over a few sessions. Patients need to practice these skills repeatedly in real-life situations. In many ways, every stressful situation can be an opportunity to practice these skills. Without this practice, people may easily fall back into old patterns when new stressors appear. When anxiety symptoms are mild or moderate, relatively recent in onset, and not lifelong, learning and practicing these skills may sometimes be enough. But when anxiety symptoms are moderate to severe, have been present for a long time, or have led to repeated relapses, medication is probably necessary to be added to the psychological treatment. Medication can help rebalance brain chemistry while patients work on changing the long-standing thinking patterns through therapy and mindfulness practice. By the way, mindfulness practice is not the same as practicing yoga or meditation. They are different. A very common question from patients is, how long do I need to take medication? My recommendation is until the time you practice CBT and mindfulness as a routine in your life. Needless to say, in addition to therapy and medication, lifestyle factors are extremely important. Regular exercise, good sleep hygiene, stress management, and avoiding self-medication with alcohol or other substances can make a significant difference. Now, there are patients whom we treat for both ADHD and anxiety disorder, and yet they still experience what they describe as anxiety. So, how about treatment for anxiety symptoms due to sensory overstimulation? In my experience, many autistics also have anxiety disorder and ADHD. I want to call it a triad of autism, ADHD, and anxiety disorder. Interestingly, the treatment for this type of distress is not anti-anxiety and not ADHD medications. It's quite different, and I will talk about that in a separate ADHD and autism video. So, why all these matter? Our current practice is to treat most patients who have anxiety with SSRI medications. Most clinicians are not trained and don't even consider ADHD and autism in their differential diagnosis. I believe ADHD and autism need to be included more comprehensively in family physicians and adult psychiatry training programs. Clinicians should consider these conditions alongside common psychiatric disorders because the management and treatment can be different. If anxiety is secondary to ADHD, they may not need any additional anti-anxiety medications. If they do have both ADHD and anxiety disorder, treatment is different than in someone with anxiety disorder alone. And when autism comes into the picture, there are other treatments we need to consider. Fortunately, awareness of these conditions is rising, but there is still a long way to go. I covered a lot of information up to this point, so now the question is, what if we don't treat the anxiety disorder? The brain and the body are closely connected. Besides all the consequences, many adults with long-standing untreated anxiety or ADHD, be it primary or secondary, develop physical symptoms. For example, irritable bowel syndrome is very common. People may experience chronic constipation, diarrhea, abdominal cramps, or a mixture of all. Other conditions I frequently see include migraine headaches, chronic fatigue, chronic pain. These symptoms may partly result from long-term activation of the body's stress system. So when someone says, I have anxiety, we need to ask deeper questions and find out, is it generalized anxiety disorder? Is the anxiety coming from ADHD struggles? Is it sensory overstimulation related to autism? Or is it a combination of all of these? Understanding the underlying cause is essential because treatment can be very different. I tried to make this simple, but in real life, the diagnosis and treatment of these conditions are often not that simple. It requires training, experience, and careful evaluation. Sometimes what looks like anxiety is actually something more complex, and recognizing that can change everything. When we identify the root cause correctly, we can help people live calmer, more functional, and more fulfilling lives. In my future videos, I will talk about other conditions that are commonly seen together with ADHD, like depression, autism, bipolar disorder, borderline personality disorder, eating disorders. So stay tuned, and thank you for watching.